So as a background, all of the metastatic patients today are included in this wide basket of stage 4 disease, but still not all stage 4 patients are the same. We know that there are so many factors that can change the prognosis of these patients, including the burden of disease. So what we did was checking if the burden of disease could change practice among patients treated in phase 1 trials with many different oncological diseases and many different drugs. And what we found was that having a little amount of disease, a lower amount of disease, was very prognostically favorable with immunotherapy and with targeted therapies. However, what we found was that this was only true with targeted therapies which were biomarker-matched, and it was not true in biomarker-unmatched patients that received biomarker-unmatched treatments. Another interesting thing that we found is that among patients receiving biomarker-matched treatments, the overall response rate was similar among patients with high burden of disease at baseline and low burden of disease. However, the duration of the responses, the PFS, was much longer for patients that had a lower amount of disease. And this really means that even if patients with high amount of disease respond pretty well to these treatments, these responses can be short-lived because there are mechanisms of resistance that are easier to come out when you have all of this disease and all of this heterogeneity. So you definitely need to develop strategies to come around this mechanism of resistance, but we have also to understand that patients in stage 4 are not all the same, and that the burden of disease evaluated with CT scan, as we did in our study, or with PET scan, or with ctDNA or other methods, can help refining the prognosis of these patients.